Welcome, everyone. I'm just going to give a brief introduction and a few words to contextualize what we're going to present. My name's Alex Milne, and I'm with the World Health Network. And in various roles, I support the authors and editors of WHN Communications. The forthcoming journal we'll be introducing and discussing today. It's special for me because I arrived here at the World Health Network after spending 7 months as a contact tracer with the Massachusetts Community Tracing Collaborative. I spoke with many COVID patients, and for some, I reached them during the most frightening experience of their lives. And themes emerged as questions. How did I get sick? Am I going to get better? What can I do to protect my family and friends? And above all, what should I do? What should I do? And it seemed clear to me, perhaps everyone in this room, that accurate, well-intentioned, reliable guidance is remarkably difficult for most of the world to find, even if that guidance exists, and we're left wandering and sometimes misled. The knowledge that we have as specialists, researchers, scientists about COVID-19, its transmission, control, and elimination is somehow not reaching those who need it the most. And I think it's this barrier to effective and compassionate communication that WHN Communications seeks to address, among other things. And I'll speed this along because I know we're short on time. So as our editors have written, the task of understanding and responding effectively to the pandemic does not fall into any single scientific discipline. To understand and mobilize the response needed to control and eventually eliminate COVID-19 requires a new approach that embraces the best possible science, as well as contributions from professions not usually regarded as part of the scientific community. So I'm very proud to introduce our authors and editors of the forthcoming publication, World Health Network Communications, an open source transdisciplinary journal dedicated to the timely and accessible communication of essential knowledge toward ending the COVID-19 pandemic. And we will begin with Gunhild. Is it all right if I read a little biography of you, Gunhild? So Gunhild, and I hope I have your name correct.
Yeah, that's good.
Gunhild is a medical researcher and a co-lead of the World Health Network. She holds a PhD in epidemiology, an MD, and a bachelor's degree in economics. Her writing has covered the long-term impacts of COVID-induced illness, particularly the effects on children, and discussion of strategies. She's also been critical in helping correct misinformation and in exposing efforts to marginalize and silence scientists. Thank you, Gunhild.
Thank you. Right.
Gunhild, let me just mention that you should be a little bit briefer than you would otherwise be, because we have taken some of the session from Martin's talk.
Yeah. Okay, I'll just shorten things a bit here and there. Okay, I do have some slides to share, so I'll try to share my screen and see what happens. Okay. So, let's see. So, is this working?
Yes.
Yes. Good. Okay, so what I will do is I will tell a little about an article that we wrote that was sort of part of the process into realizing that we needed a journal, and this was an article that we wrote together as a collaborational effort in August, and we were worried about school openings, so that's sort of the main issue. And the article is called Pandemic 2.0. Where do we go from here? The Delta variant and the young. And it was a very interesting process because it ended up as a very interesting collaborational effort. It was an idea that I had, and I brought it into this group of very distinguished scientists, and we discussed this and realized that we could write this article together. And I must say, the most interesting thing here, you can see the list of authors, and these are scientists with very different backgrounds and from very different parts of the world. And to me, it was very interesting to see how little we disagreed, that we have been sitting in our parts of the world and reading the same science and reaching the same conclusions, so or similar conclusions, but still a very interesting sort of internal peer review along the way. So that was very interesting, and so we wanted to sort of write this article to ask the world. So okay, so we're used to looking at the number of infections, hospitalizations, and deaths. But what happens now when Delta is arrived and most populations have been partially had the vaccines? So will these still be appropriate measures? And we weren't really sure about that. So with Delta, the main part is the increased transmissibility, which means that the threshold for herd immunity increases quite significantly. So a higher proportion of the population must be immune to slow the spread of the virus. And is herd immunity attainable? So it's clear that you need to have non-pharmacological interventions in combination with the vaccine to slow the spread of the virus. So this is why we were worried about transmission in schools. And the focus was on school openings. So we wanted to get this article out there before school openings. And we realized that was difficult. And it turned out at that time, this message wasn't really very popular, it seemed. People were wanting to reopen and start living normal lives again. And we actually met quite some difficulties in getting the publication or the article published, especially in Norway, in my country. So we didn't actually get it out until in time. And I don't know if you can see my cursor here, but you see this table is Norway, and it's the number of infections per week per 100,000 per age group. And in Norway, schools started week 33, and no measures and no vaccines under the age of 18. And you see already by 1 week later, the spread has exploded. So it was kind of frustrating not to be able to reach out there with our message. So that's why it's good to sort of have a platform. I'll do the content of the article fairly briefly, and just chime in when the time is up. But the idea is that this is not just a respiratory virus, that we do see long-term complications also in form of serious organ damage and multi-system inflammatory syndrome that also has organ affection. Although this is rare in children, it does happen. And also, we were worried about the neurological complications of COVID. This relates to all ages. But there are discussions whether the virus can actually enter the brain, possibly via the olfactory route. There are reports of loss of grey matter in the brain, in areas of the brain regulating smell, in mild disease, and also actually in memory-related parts of the brain in serious illness. And there are reports of reduced memory and cognitive deficits after this illness. Even a question of increase in risk of neurodegenerative illness. And all of this has continued to develop afterwards. So what about the young then? Well, we know very little. We know far too little, and we still do. But we know that some hospitalized children actually had more neurological and psychiatric effects from COVID than hospitalized adults in one study, and that 10 to 15% of the young in some studies have problems with concentration and memory, although these figures vary dramatically between different studies. So the thing that was our point is that these are the kind of symptoms that may have deleterious impact on education, on cognitive and social development, which is very important for children. And the increase in cases, the increased number of cases will lead to an increased number of complications, even though we hope they are at a low rate. So, but with Delta, the increase in number of cases may be dramatic. So we might see quite large increases in the number of complications. And none of this will be reflected in the number, or very little of it will be reflected in the number of hospitalizations and deaths. So, so the way we are used to measuring or controlling the pandemic may actually not reflect these issues at all. So that was one message, and then we also wanted to say this: every infection is a ticket to the variant lottery. That minimizing the number of infections is the best strategy to prevent the emergence of new and more dangerous variants. And that if your country decides to stop controlling the virus, you add not only to your own risk, but to the risk of the whole world. So that in solidarity with the world, we must control the spread of the virus, and that vaccination and non-pharmacological interventions must be used in combination in schools, and that in this scenario of high risk and uncertainty, where we know that vaccines will probably be available for more age groups within a short period of time, which is what we're seeing happen these days. Mass infection of the young is not an ethically defensible option. So that was the message that we sort of wanted to get out to the world, and we still do. So that was my part. Thank you.
Thank you so much, Gunhild. Yes, difficult but important work. And I think we're just going to move things right along, and we'll now transition to Carlos. And if Carlos, would it be all right if you could? Yeah, there we go. So Carlos Gershenson is a tenured research professor at the Universidad Nacional Autónoma de Mexico. I hope I did all right there, Carlos, where he leads the Self-Organizing Systems Lab. Carlos is a co-lead of the World Health Network and serves as the editor-in-chief for World Health Network Communications.
Thank you, Alex. Well, I'll tell you a bit of the story. Already in January 2020, Janir and others began organizing with zerocovid.org. They started publishing guidelines on what to do. For example, if someone in your household is infected, how to take care of them without getting infected, how to minimize risk of contagion when, let's say, there was very little information in general about the virus. And then when the COVID Action Group was formed, we began also publishing short texts, especially earlier this year. when many people were already assuming that the pandemic was over, and relaxing restrictions, face masks, gatherings were happening everywhere. Reopenings, we published several articles, short pieces, also sharing the experiences of different countries, so, including India, also in particular case in the United States. And I think this was very useful to spread information so that people would have knowledge of what was working and what was not working. And also in the late summer, when many countries were preparing to return to schools, to classes physically, we published material, including infographics on how to have in the safest way possible presential classes. So there was also videos that were published, sharing information, informing the public, trying to give advice so that people can make the best possible decisions. So there was the idea of formalizing all these efforts into a single journal, which is digital, and this is World Health Network Communications, also now as a part of the World Health Network. So trying to encompass everything that we did already, and kind of giving us a platform to distribute authoritative comments and peer-reviewed information that people will be able to trust. Backed by science, and also to share it through different media so that people are able to make better decisions. So it's like one of the many efforts of the World Health Network is precisely to spread information, and we will collaborate with the rest of the World Health Network to achieve its goals. So we are about to launch the journal. We have already several pieces that are on print, and it will be freely accessible. So very probably you will receive news on when it's launched, and we'll be looking forward to collaborate with you in publishing relevant information. I think Blake was going to share.
Oh, okay. Thank you,
Yep.
Carlos. Blake, are you next, or was it going to be Yanir?
I think if Yanir has comments, he's welcome. Otherwise, it would be me.
Okay. I'm not hearing anything from Yanir, so let's move to Blake then. Let's see, Blake, if you want to drag yourself up to the speaker podium. There we go. And so first, I want to thank Blake for pretty much organizing the session. He's definitely deserves some credit there. And Blake Elias is a researcher at the New England Complex Systems Institute. His research has applied decision theory and optimization to determine the optimal economic response in the face of a pandemic. Take it away, Blake.
Great, thank you, Alex. And I'll just go and share screen here. I do have a couple slides. Let's see, and people should be seeing this.
Yep.
Great. So I want to take some time and talk about what we mean by the phrase science-based policy. Because I claim that fundamentally society has misunderstood some subtlety behind this common phrase, and that it may be worth spending some time to just re-examine what we mean by what would be an actual rigorous process for science-based policy. I'm here to propose that we might conduct science differently, and we might communicate it differently, when the point is to impact policy above and beyond the usual audience of other scientists. And the point is that this connects to the journal, the World Health Network communications that will be forthcoming, that we're designing the journal around sort of a new scientific method for policy. And so I want to spend a little time, talking about what we mean by this, and then delve into a little bit of how the journal is designed around this, and what makes this a unique interdisciplinary journal. So here's a process that we've put forward. There are 4 main steps to this process, and I'm going to start with this one here on the bottom right, implementation. So at the most concrete level, the point of policy is to produce actions in the society. These are specific concrete actions that we take when a crisis might emerge, or really in any type of policy. And so we call this the implementation, the processes, the planning, the timing that goes into actually implementing a policy. Now, there's something, to move on to the next step, there was something that Gunhild pointed out in an earlier session, which is that there's a difference between taking certain actions and having a strategy that you're following. And the actions can be guided by some overarching strategy that has a more concise explanation to all the actions that get taken. So in the case of a pandemic, the types of strategies include elimination, suppression, mitigation. These are terms we've been hearing, and these are sort of paradigms that one can adopt when responding to a pandemic. And this requires making a very clear decision that we're going for elimination versus we're going for mitigation, for instance. And so that's this decision step, is knowing what we value, the link between what actions we take and what effect they might have, and at the end, picking out one sort of particular approach that will guide action. But what strategy you pick should be determined by something. So what is it determined by? That's the third step. And this is where we get into the realm of science. This is where we talk about describing the world. And so to make a sound decision, one needs to understand the world and how it behaves. And this requires data. It requires analyzing that data to distill certain key takeaways from the data, and to have those takeaways be the right ones that should actually inform the decision versus, they say there's 1,000 ways to lie with statistics, or this type of thing. So picking the right approach. And that's where we get into the fourth step, this meaning, because while the description phase is about just doing the statistics, gathering the data, pulling out those parameters from the data and putting them into a decision, this earlier step, this meaning step, is really about how we even interpret data. The data can't tell you everything. You can't run every possible experiment. You can't collect every possible data point you might want. And so when you're looking at data, you're looking at it to find out what can we infer that we haven't seen directly, but that we know must be true. And that process of knowing what must be true, despite having not directly seen it, is what it means to understand the meaning of the data. So this is having a sound theory. This is understanding, so for example, why a pandemic? Why does it grow exponentially? Why is it a fat-tailed process? These types of just universal properties of the process that you're interested in, through which you'll better understand the data that you're seeing. So we only have one case, but that one case easily becomes 100, easily becomes 1,000. Understanding why that's true, even though you haven't yet seen it. And so these are sort of 4 steps that have to be in place to do rigorous science-based policy. So the 2 left boxes are really the science part, and these 2 right triangles are the policy part. And it's important to note that while the science will always be in flux, it's always in a state of refinement and improvement, we don't have the luxury of waiting for scientific certainty before acting. And so there's always a decision calculation that we need to be doing. Whatever state the science is in, we still need to act. And we know that inaction is also action. So there's this common error which says the science is uncertain, therefore we cannot base our decisions upon it. And this is simply not true. Whatever state of science you're in, whatever knowledge you have at that time, there's always a framework you can put on top of that science to make a decision given the uncertainty you have. This is called decision theory, and the point is that it's different to write a paper about medicine and the raw biology of a virus than it is to write a paper about policy and risk management. And so that's sort of this distinction, and that's why this journal that we're putting forward needs to be multidisciplinary. It needs to bridge the core biological science, in the case of a pandemic, into more risk management and ultimately applied decisions. And we know that the science, while it may not be right, the policy has to be right. You really want to make the right choice because the wrong choice can cost many, many lives. This was an example. Michael Baker spoke earlier on sort of different strategies behind pandemics, and so this is just an example of the decision step being sort of 5 primary choices you have in a pandemic versus sort of the dozens and hundreds of actions you might take at the implementation level. So the sort of need for a high-level strategy to guide it. In any case, so there are different goals between traditional science, which is around accumulating knowledge, and science for policy, which says, well, whatever knowledge we have, let's make the right decision today. One is a long-term process. One is sort of an immediate, in the face of uncertainty. One is sort of objective. It tells you things that depend of any values that you have, things that are just true. But science for policy has this value-based aspect that has to also come into it. And there's a couple more properties that are sort of different. But the point is that science that aims to impact policy needs to work differently than the traditional science we think of. And so that also means that the work needs to be reviewed and evaluated differently. And this is where the process for publication comes in. And we have some way to shape what kinds of pieces we put out. And so one aspect of the journal will be having 5 types of publication, five columns, if you will, in each issue. And each type of publication that we put will sit at a different step of this process. And this is one way we hope that we can clarify society's thinking around this whole process of learning a new situation, understanding it, and then acting on it. So if we remember these 4 steps I described, they each sit in some phase of those steps. So for example, one article type will be these reviews, and these are meant to be scientific pieces. So they will look at data, they will assess the meaning of that data, and based on this lens of meaning, will form a description about the world. They make a statement about what is happening right now and what might happen in the future. This is purely a scientific process, and the decision choices will be deferred to a different type of article. So this updates will be another type, which says, okay, something has changed in the world, so we have a new description to work with. How do we think about the decision from that news? Okay, so just bridging that step. A guideline will be, again, a different type that says, okay, supposing you've made this particular decision, how do you implement that correctly? If your decision was mitigation, how do you implement that? If your decision is elimination, how do you actually get elimination? That's what this would be, specific, whether it's border closings, tracing, actual detailed policy actions. And we'll have a couple other types that are more high-level summaries that encapsulate multiple steps as well. A response might be something very rapid. The world changes, we need an immediate update to our decision analysis and immediate implementations right away. One-stop shop, a policymaker, in theory, should be able to read this and know everything they need to know about a particular event that has changed. And an editorial will cover sort of the whole big picture, bird's eye view of an entire crisis or an entire situation. So our hope is that by having sort of different types of articles that we distinguish and that we review differently, and we have different criteria for, can really clarify what exactly we're talking about when any particular conversation gets started. We're all too busy in social media seeing, oh, a new fact came out, some new situation changed, and here's what we should do. And the jump, we very easily skip steps. we've seen some new thing and we immediately say that we should take off our masks or put them on or something. And we've sort of skipped this intermediate step. So the point that we're aiming for is to really clarify what the steps are and what exactly we're talking about at any moment in time. And by institutionalizing this, we hope to shift some conversations at a big level. So with that, I'll stop. And I believe I should stop my share.
You're stopped. Thank you, Blake. Fascinating. So next we have Greta Fox. Is Greta here? Yes, I think she is.
Yep.
Hi, Greta.
Hello.
So if you want to drag yourself over to where Blake is, then you'll take the podium.
Okay.
And just a reminder, I don't want to put any pressure on you, but we are running up against the clock here. So Greta Fox is a nurse practitioner, a COVID event safety activist, and a volunteer healthcare expert with the World Health Network. Her writing has included guidelines for event safety, as well as calls to government health authorities to strengthen mask guidance given the airborne nature of COVID-19.
Thank you very much. So what I'm going to do is I definitely cut this down and I'm going to talk kind of fast. As my topic is COVID event safety, follow the science. And as both a nurse practitioner and manager of my husband's photography company, this is an area of special interest to me. And we're very involved with industry associations, the sponsoring members. So I'm trying to, leverage that to have some influence. So conferences and events are coming back, bringing travel and tourism with them. The events industry is trying to keep current on science-based event safety. There are companies that offer various trainings and certifications, but unfortunately, many, if not most, are still following misguided droplet and surface precautions with insufficient attention to ventilation and other airborne precautions. And this, as we know, is because the administration continues to fail to inform the public that COVID is airborne. And they are failing to provide robust guidance, support, and enforcement of indoor air standards. I identify that without this, any indoor gathering is riskier than it needs to be. And indeed, we risk creating more super spreading events. So my intended audience for this piece is the community of the events industry. And the goal is to bridge science into this community with myth busting and practical advice, which is a nurse thing, okay? And that's the reason for the tone of the piece. So with a disclaimer, there's still risk involved in holding live events, and the best thing would be to hold off. I go through some of the myths and facts about how COVID spreads and what actions event professionals can take to best protect ourselves and each other. It's just an overview. There's more resources on the website, including a video and a PDF. Can someone mute there? Thank you. So the first myth, and I'll try to whip through this pretty fast because we know this, but this is just to show what I express to people. That the first myth is that COVID is over because of vaccines, and it's pretty to think so, but we know that vaccines are powerful, but they can't do the heavy lifting alone. There are other vaccine presentations here, but a couple of things that I do emphasize is that vaccines do help keep you out of the ICU and the morgue, so that's good, but they're not 100%. And the likelihood, this is what people don't realize, the likelihood of long COVID is the same for breakthroughs as for unvaccinated infections. And it occurs in a staggering about a quarter or a third of cases. We don't know for sure because CDC is not really tracking them properly. The 120 million Americans who are about to become eligible for boosters should no longer be considered fully vaccinated. And that's where we are. So the actions I recommend are to get fully vaccinated, booster as soon as eligible, encourage and enable others to do so. Require proof of vaccination. I explain this is not HIPAA protected information outside of a healthcare setting, but don't rely on the vaccine to fully protect you. Keep wearing a mask, social distancing, and most importantly, pay attention to ventilation. The next myth is so pervasive. It's the one that COVID is spread by droplets that fall to the ground in a 6-foot radius, and that you're safe as long as you keep your distance, wash your hands, and sanitize surfaces. And statements about cleaning and distancing appear in every training program, in every venue's COVID section on their website, with few even mentioning air management. So that's the status of that industry. So the facts, COVID is airborne. It's primarily spread by inhaling aerosols. While cleanliness is important for many reasons, there is no proof that surfaces or droplets are significant contributors while there are mountains of evidence for aerosol transmission. And again, there's more detailed presentations on this here, but the highlights communicate the science about aerosols, that they're tiny, that they infect by getting inhaled deep into the lungs, but droplets drop and they're too large to inhale. Aerosols are more concentrated around the source. So yeah, distancing helps, but they can linger and swirl around in the air like smoke for hours, even after the infected source leaves. After a while, we're all breathing each other's air. Plexiglass barriers can make this worse by creating a negative pressure zone, which draws aerosols right at the person standing behind them, which points to the importance of following the actual science when spending money on mitigations. So the actions, again, I'll just go over the highlights, but I tell people to think clean air is the new clean drinking water, and don't share your air, and the rest will pretty much follow. So short, I don't have any slides, but I have show and tell. Clean high-touch surfaces, sure. Clean your hands, sure. Okay. But focus on preventing airborne transmission. So high-quality, well-fitting masks worn properly are essential indoors and in crowds and in proximity to others. N95 or KN94 or 95 is your best bet. And a quick pro tip, you put this in your pocket, you get a little sharp peak here, then you put it on your face, and you've got aerosol leakage. So pro tip is to take your clean thumb, put it inside that peak, roll it around, and then when you put it on your face, adjust the straps. Now you have a much nicer seal. In spite of all the current hype based on misrepresentation of studies, surgical masks were not designed to protect against aerosols, but a lot of places are requiring them, which is very frightening. And that's because they fit loosely. Okay? So they don't do a good job against aerosols unless you add something like a fix the mask brace, which goes over it. I'm not going to demonstrate that here. You can get it at fixthemask.com. Event branded, what they call swag masks, tend to be extremely poor quality. So yeah, take off your mask indoors and put on this little piece of junk. It's not going well. Taking masks off to eat and drink indoors is a big problem because, as we know, the virus does not politely excuse itself to accommodate dining. So I advise transitioning activities, especially dining outdoors when possible, avoiding closed tents or bubbles, and continue social distancing, key being indoor air management. Again, there are other excellent presentations on the ventilation at the summit, but just briefly for context, people don't really even know the terminology. Ventilation is bringing in outside air. Filtration is cleaning indoor air. There's a super FAQ on protecting yourself from aerosol transmission on the WHN website resource page to help you with what to look for and what to avoid, like non-HEPA junk filters, which many venues have unfortunately wasted large sums of money on. Again, following the faulty science studies contracted by some manufacturers. And planners should ask venues in detail about this before booking the place and make it clear that it's both a priority and a deal breaker. Another two more myths and then I'm done. One is the idea that screening will prevent infected people from attending an event, and symptom or temperature screening have greater than a 50% miss rate because not everybody gets symptoms. Those who do are contagious before they develop symptoms, and that's when most infections are spread. And many factors can affect an accurate temperature reading. So consult a health professional about how to do this right. You can do a little better than saying, you don't have any symptoms, right? Come on in. That happens. But while it may help, don't rely on screening alone. And finally, the myth that testing will prevent any infected people from attending an event and that proof of a negative test is an acceptable alternative to proof of vaccine, which unfortunately Biden has promoted this. Fact is that tests are incredibly important and they should be widely available and either free or at the very least cheap, or at the very least you should be able to find one. They can screen out some people, yeah, and they can add another layer of protection, but it's a false equivalency to say that they're an acceptable alternative. And this is because the problem is it takes a few days after exposure for an infection to show up in a test. False negative rate can be, I keep hearing they're 95% effective, but that's not what's happening out in the real world. They can be up to a third false overall, especially if you test the day of or the day after exposure, you're going to get 100% false negative. So what good is that? And if people get exposed after they take the test ahead of the event, but between the test and the event, that's not going to get picked up. So what I advise is that if they're going to test on site, bring on professionals to handle it safely. But while it helped to not rely on testing alone, you'll have another Rose Garden event like we had last year here in the States. So to summarize, we in the events community cannot afford to fool ourselves into thinking that it's not still risky to run a live event. But for those who are going to go forward, you want to keep in mind that COVID is airborne and that by understanding the science and using multiple layers of protection, we can keep safer together. Thank you.